Melissa Fuller with Shape of the City. I am at Health 360. I am with Dr. Erica Peterson and Karina Ruiz Vargas. And we're going to talk about breastfeeding and how that's being integrated into a number of Bluestem Health organizations or entities. So, hi Erica. Hi Karina. Let's talk a little bit about how Bluestem Health has gotten involved with breastfeeding. You give us a little lead in?
Sure. So here at Bluestem, we'd always been interested in supporting breastfeeding moms and families. And recently we applied for a grant that gave us some extra funding to try and take what we were doing to support our families to the next level in conjunction with some community partners. And so we've just been working as a team and working with our community partners to provide even better support and services for breastfeeding moms and families here at Bluestem.
Perfect. Can you talk about what some of those programs are looking like?
Sure. As an initial step, we felt like in order to provide the best care, we really needed to define what that was. And so as an organization, we met as a team in conjunction with our partners through Partnership for Healthy Lincoln and Workwell, and came up with sort of our vision for what we should do as an organization to support breastfeeding moms who are employed here at Bluestem, both internally, but also for our clients and our patients when they come here for care. So we actually wrote a policy, or wrote a procedure, which kind of outlines what we aim to do to support both our staff and our families when they come to Bluestem.
And you received a grant, correct?
We did. So we were really excited because it was a fairly competitive grant that it was put out through NACHO, which is the National Association of County and City Health Officials. And they had over 30 applicants from community health centers across the country. And we were really lucky to be one of 4 centers that they selected to support to try and expand what we offer as a community health center to patients in the Lincoln community.
So since the grant has gone through, what have you guys started to do?
Yeah.
I can kind of talk a little bit about what I do here at Health 360. So Dr. Peterson and other providers are able to send me some requests to help some moms that are struggling with breastfeeding, or some moms that are pregnant, so I can give them information about breastfeeding ahead of time. So I am a certified lactation counselor. I'm able to help moms. Just with the basics, but we can always send them to places like MilkWorks if they need anything more than the basics. Sometimes it is a little bit more difficult to get out there, so I am here as a resource. If moms need me, mostly I work with latch and supply. So
why is it so important to give support, I guess? Where is this need coming from?
Sure.
The need for support has come up because it used to be something that we used to do, but then once people started thinking that formula was the only way to go, we had to kind of backtrack and say, well, the natural thing would be the priority, not that people can't give their kids formula, but just to support moms that do want to breastfeed, but can't figure it out because of latch, or can't figure it out because there's another issue that has come up that sometimes is very simple to solve, but moms just don't know where to go to do that. So we decided to be that resource for moms.
And what we found, I think, as a community, with some of the efforts that our community partners had already made, is that as a community, a lot of moms start breastfeeding in the hospital, and then you're kind of on your own. So those resources in terms of planning and support when things get hard become even more critical. And what we found is a lot of our clients find it hard to access some of the resources that have already been developed in the community. So a lot of what we've done with this grant is work with them to try and bring some of that great work that our community partners have already been doing here to our patients at Bluestem by holding some educational activities. We plan to also hold some pump clinics where they can come here to get their pumps so they don't have to drive across town, those kind of things, just to try and bring some of those wonderful resources we have here as Lincoln to the people here at Bluestem that are coming for care.
And what has the feedback been, even within your employees?
I think that overall people are excited that that we are providing them with tools so that they can better help families that are coming to Bluestem. I think all of us, we strive to provide the highest quality of care for people that are coming here. And anytime you're giving folks an extra tool that allows them to do that better, I think it's exciting as a provider. So the feedback that I've had has been really, really positive.
And the feedback that I've gotten is also very positive. I think that everyone was very supportive of breastfeeding already. My coworkers have always been very supportive of the stuff that I do and have done with breastfeeding. But I think it also gives them more knowledge. A lot of times they're very surprised by the stuff that they learn. And I feel like all I do is talk about breastfeeding. But for the most part, I mean, everyone loves it. And they talk about how great it is and how much more they learn. And I learn myself too. So every time that I see a patient or anytime that I see someone who needs some help, sometimes I learn myself. So.
And I think along with that, I think as providers and nurses and other staff, I think we are all trying to learn how to better support our patients. So a big part of this grant has an educational piece too. So we've already held a training for our providers, and we're very grateful that one of our partners, which is Milkworks here in town, sent over Kathy Leeper, one of their lead physician, over to spend some time with our providers, educating them about how they can better support breastfeeding moms. And the next pieces are kind of building out some more education for our nursing staff so that they can assist Karina with some of the things she's doing. And then we are also training all of our staff just about the importance of breastfeeding. And so that grant has sort of enabled us to put some pieces in place so that we have the education we need to do a better job with what we're doing.
So let's say in a year from now, where would you love to be? What would be your dream for your organization?
Been working really hard to do more than just be a CLC. So I am trying to see what I have to do in order to become an IBCLC, which is an internationally board certified lactation consultant. And I think that would be a great goal to have and a great goal to achieve. But for now, I know that I am helping moms regardless. So that's very helpful. And I do speak Spanish, so that is one of the barriers that I'm helping with, especially patients that sometimes don't even know that there is access in that way, with the language barrier being one of the biggest barriers in their life. So today I'm actually giving a presentation in Spanish in the afternoon. So hopefully that helps a lot of moms gain some knowledge.
Wonderful.
And I think personally, my goal would also be to just have a good, solid foundation of systems in place to make sure that we are providing the resources that our patients want. And so we're working, part of the grant that's been useful for me is just to hear what some of the other bigger community health centers that have this grant in big cities are doing. And my hope is to kind of have even more handouts that are available in multiple languages, to have a process that we can connect them with Karina, to have other people trained within our organization that can also help her with that process. And then just being sure that no one feels unsupported if that's something that they're interested in doing. That's my long-term goal.
All right. So if maybe one of your patients is listening right now or watching this, where can they go if they have questions, or what would you suggest?
They're definitely welcome to come here to Health 360 if they have any questions about breastfeeding. If I can't fix those or I don't have the answers, I can always send them to the best resources that I have available. So they're definitely welcome here. And I know that some moms hesitate because they think things are silly or they shouldn't be going through this because it should be something simple, but it's not always that simple. And even if it is that simple, sometimes you just need a little push or someone to kind of give you, that information that you just need. So,
Any last words, guys?
We have such amazing partners here in Lincoln, both through partnership for Healthy Lincoln and Milkworks, that we were able to work together to write this grant. And I've just appreciated that partnership and then the opportunity through the funding to at least get the ball rolling and get those foundations set. And I'm just so grateful for everyone within Bluestem who's been working really hard to make this happen, and especially to Karina for all the work she's done.
Well, I appreciate you too, Dr. Peterson. I know that it's been fight for the finish, so we're getting there, and once our grant is over, it doesn't mean the project is over. It's just starting. So laying down the foundation sometimes can be the hardest piece, but I'm excited too.
Well, thank you guys both, and I'm really excited to hear how this keeps progressing, and maybe we'll check in a little while.
Yeah.
Thanks, guys.
Thank you.